This is a little bit of an oversimplification, but when we think about my gut is a mess, we typically think the problem is just in the gut. And in CIRS, that's not how it works. In CIRS, there's two high level features that I think are very important that usually are at the core of the problem when it comes to the gut. The first problem often in CIRS patients is permeability. We already alluded to this. Loss of barrier integrity. And in CIRS, when we talk about permeability, we're not just talking about the gut. And often you'll hear the word leaky gut in like social media and that kind of thing. But it's not just that. It can get extremely systemic for some of us. The sinuses become very permeable, the gut becomes very permeable, and the skin becomes very permeable. For those of us who've had history of skin issues, eczema, acne flares, shifts in skin texture, skin feeling very thin, overly dry, and there's these shifts that you can't quite explain why it becomes dry and then it goes away. This is all indications of permeability problems and these barriers. So we got to understand that this is happening at a systemic level. For some of us, it will hit us really hard and we will notice it. For some of us, it might be very subtle. And this type of permeability issue starts improving with sinus treatment usually. And neuroendocrine signaling, in other words, the MSH, the ACTH and cortisol, the VIP, activity, sex hormones, thyroid hormones, melatonin, all of these neuroendocrine signaling molecules, when they start finding their way into being calibrated, and I think MSH is just a big proxy, a good marker of things are starting to come back online. Some of that permeability tends to follow along, strengthening the barrier compositions of these tissues. So permeability starts, you start often seeing movement. And in that sense, permeability in the gut can improve passively. There's a version of gut improvements that can just come out of just doing these things. The sinus treatment and just doing those foundational 3 steps, if you do them properly and in the CIRS treatment protocol, that you'll get some value back in this department.